Hello, my name is Pete Smith and I'm one of the clinical neurologists at Davies Veterinary Specialists. What I wanted to do today is to talk to you about some of the details surrounding a case that we saw here relatively recently, which is a dog that presented with tetanus. What I wanted to start off with first of all is talking a little bit about how tetanus toxin works and why it has the impact that it does on the nervous system and therefore why you see the clinical signs that you do. So the toxin that is responsible is called tetanospasmin, and as you probably know, this is a toxin that's produced by the bacterium Clostridium tetani. And what tetanospasmin does is it interferes with the way that synaptic transmission occurs. And I guess to understand how exactly it has that impact, it helps to just have a little bit of background about how synaptic transmission occurs in the normal patient. So what happens when an action potential arrives at the nerve terminal is that it triggers an influx of calcium into the nerve terminal. That enables the synaptic vesicles to dock with the presynaptic membrane. So there are molecules within the membrane of the synaptic vesicle where the neurotransmitters are, and they will bind to relatively close related molecules on the presynaptic membrane. And so the synaptic vesicle fuses with the presynaptic membrane and it ends up disgorging its contents into the synaptic cleft. So the neurotransmitter can then cross the synaptic cleft and it can act on the postsynaptic membrane. It's not particularly relevant to know all the details of it, but some of the molecules that are involved in this are called SNAP25, syntaxin and synaptobrevin. And probably the most important of those from the perspective of tetanus is the synaptobrevin because that's where the toxin acts. So tetanospasmin is a toxin that comprises two components. One of them that permits it to enter the nerve terminals and to be transported along the axon to the spinal cord. So it hijacks the body's system of retrograde axonal transport and gets moved back up the nerve, and it then crosses the synaptic cleft and enters spinal cord inhibitory interneurons. And these are neurons that are producing glycine as a neurotransmitter or GABA, gamma-aminobutyric acid, both of which are inhibitory neurotransmitters in the spinal cord. So it gets into these neurons, and it's there that it interferes with this machinery that enables synaptic vesicles to dock with the presynaptic membrane. So it blocks that process, it breaks down the synaptobrevin, and it blocks that process of the synaptic vesicle fusing with the presynaptic membrane. The end result of that is that the neurotransmitter can't be disgorged into the synaptic cleft, so you end up blocking this inhibitory transmission. Now, the action of these neurons, these glycinergic and GABAergic neurons in the spinal cord, is to have an inhibitory braking effect on the normal somatic motor neurons. So when you interfere with the production of these inhibitory neurotransmitters, what you're effectively doing is you're blocking the normal inhibitory effect that these neurons have on motor neurons in the spinal cord. So the motor neurons, which are firing all the time, are normally inhibited, but if you block that inhibition, you increase the rate of discharge of those neurons and you therefore increase the muscle tone. And that's what gives you the clinical signs that you see of a gradual increase in muscle tone and ultimately progressing to an uncontrolled and very severe increase in muscle tone. Because of the way that the tetanus toxin gets there, which is by being absorbed back up through the peripheral nerves and crossing into the spinal cord or into the brainstem, it will tend to have the earliest impact on the shortest nerves. So, which is one of the reasons that you tend to see clinical signs affecting the facial muscles before you might see them in the limbs. Although in a lot of cases, by the time we see patients, you can clearly detect that limb muscles are affected as well. And it's also important to realise that it's not just the somatic musculature that's affected. You also get an impact on the autonomic nervous system, and in severe cases you can also have seizures. So these GABAergic and glycinergic neurons have quite widespread inhibitory effects And if you interfere with those, then you can have quite a widespread increase in activity of an awful lot of neurons within the nervous system. Interestingly, tetanospasmin is very similar to botulinum toxin as well, which, as you know, is it's another incredibly potent toxin which is produced by a related bacterium, Clostridium botulinum, and that acts in a very similar way, also by interfering with the way that synaptic vesicles dock with the presynaptic membrane. So it stops the disgorge of neurotransmitters into the synaptic cleft. The key difference between botulinum toxin and tetanus toxin is where it acts. So with botulinum toxin, the action is at the neuromuscular junction. So if you block synaptic activity at the neuromuscular junction, you're not releasing any acetylcholine into the neuromuscular cleft, and so you can't get any stimulation of the muscles, and that results in a flaccid paralysis. The tetanospasmin, in contrast, gets absorbed into the nerve, gets back up into the spinal cord, and it affects the inhibitory neurons, so you get an overactivity of the somatic motor neurons, and that's why you get an increased muscle tone in tetanus versus a dramatically decreased muscle tone and flaccid paralysis in botulism. Interestingly, some of the tetanospasmin can sometimes have a direct effect at the neuromuscular junction before it's absorbed into the nerve and gets back up into the spinal cord. And the net effect of that is that it has the same impact as the botulinum toxin there and can actually cause a temporary flaccid paralysis of the muscles. However, that's exceptionally rare to appreciate that. It's much more obvious to just see the general increase in muscle tone that you get from it being absorbed into the inhibitory motor neurons in the spinal cord. Okay, so that summarises this section where we've just been talking about how tetanus has its impact on the body and why it results in the clinical signs that it does. If you want to check back on Wednesday, then we'll be talking a little bit more about the clinical signs of tetanus and how we go about treating them.